All right, today we're going to tackle something pretty terrifying. We're talking about one of the scariest infections you can imagine, and this one controversial therapy that might, just might, be our best shot against it. So let's get right into it and look at the actual evidence for something called hyperbaric oxygen therapy.
Yeah, you heard that right. Some of the actual medical literature calls it the flesh-eating bug disease. It sounds like something straight out of a horror movie, doesn't it? But honestly, that name really gets at the absolute terror and just how fast this thing moves. All right, so what exactly are we dealing with here? Let's get into the specifics.
Okay, so the official scientific name is Necrotizing Soft Tissue Infection, or NSTI for short. And the scary part is that it can start from something so simple. A little cut, an insect bite, even a surgical wound. But the thing is, once it takes hold, it just moves with this horrifying speed, literally destroying everything in its path. And when we talk about stakes, they could not be higher. Look, even with all of our modern medicine, the mortality rate is just staggering. We're talking 20 to 30%, and sometimes it's even worse than that. Just think about this. The infection can spread at 2 to 3 centimeters per hour. That's why the standard treatment is literally a race against the clock. Just aggressive, repeated surgeries to cut out the dead tissue, all while blasting the patient with the strongest antibiotics we have.
But what if there was another way? What if you could fight this monster of an infection with something as basic, as fundamental as oxygen? Well, that question brings us to a really interesting, but also really debated potential therapy.
It's called Hyperbaric Oxygen Therapy, or HBO for short. And the idea is actually pretty simple. You put a patient inside this special pressurized chamber, and they just breathe pure 100% oxygen. What that does is it forces a ton of oxygen deep into their bloodstream and tissues, way more than you could ever get just by breathing air normally.
So, okay, how is this supposed to help, right? Well, the theory behind it kind of breaks down into three main ideas. First, that super high oxygen environment is actually toxic to some of these bacteria, especially the ones that hate oxygen. Second, it's supposed to supercharge your own immune cells, give them the juice they need to fight off the invaders. And third, it just floods all that damaged tissue, which is starving for oxygen, with exactly what it needs to begin the healing process.
But here's where it gets messy. For all that promise, HBO is super controversial. You've got some medical societies that say, yeah, use it as an extra therapy. But then you have others, like the really influential Infectious Disease Society of America, that flat out recommend against using it. Why? They say there just isn't strong enough evidence. And it's this huge disagreement that made researchers say, okay, we need to figure this out.
So let's get to the good stuff, the data. In 2023, a group of researchers published this huge review, what's called a meta-analysis. They basically pulled together the results from 23 different studies to see if they could finally get a clear answer on this. And when I say huge, I really mean it. We're talking about data from more than 49,000 patients. 49,000. A number that big is so important because it lets you see the bigger picture, You can spot patterns that you'd totally miss if you were just looking at a handful of smaller studies. And they zeroed in on the one question that really, truly matters. Does it save lives? For patients with this horrible infection, does adding HBO therapy to everything else they're getting actually make them less likely to die? It's as simple and as serious as that.
And the answer they found, well, it was pretty dramatic. Take a look at this. For the patients who did not get HBO therapy, the mortality rate was about 25.6%. But for the patients who did get it, that number dropped all the way down to 10.6%. I mean, that is a huge difference. It basically cut the risk of dying almost in half. So a massive drop in the death rate. That's it, right? Case closed? HBO works? Well, not so fast. Because when the researchers started digging into the other outcomes, the story got, well, a lot more complicated. Okay, for example, you'd think that a treatment that helps fight the infection would mean fewer surgeries, right? Less need to go in and cut away dead tissue. But what they found was the complete opposite. The patients who got HBO therapy actually had more of these debridement surgeries. Now, the researchers think this might be because, frankly, more of these patients were surviving long enough to even have these extra surgeries, which makes sense in a way, but still, it's a really surprising result. And the plot thickens. When they looked at amputations, another absolutely devastating outcome of this disease, they found no real difference. Zero. There was no statistically significant change between the group that got HBO and the group that didn't. So it didn't seem to be helping to save any more limbs.
So let's just pause and recap for a second. We've got a therapy that seems to save a lot more lives, but it's also linked to more surgeries, and it doesn't seem to prevent amputations. So what in the world are we supposed to make of that?
And that brings us to the million-dollar question here. If the numbers show such a huge drop in people dying, why on earth do the authors of this giant study and a lot of other doctors still say the evidence is weak? Well, the answer really comes down to this. Not all evidence is created equal. See, every single one of those 23 studies they looked at was retrospective. That just means they were looking backwards at old patient records. They weren't setting up a perfect controlled experiment from the start. And you can see why, right? I mean, you can't ethically take a group of people with a deadly disease and just flip a coin to decide who gets a treatment that might save their life. It's just not possible. So what we're left with is this messy real-world data. And that makes it really, really hard to say for sure that HBO caused the drop in deaths. And the study's own conclusion really just sums it all up perfectly. They literally say that the evidence suggests that HBO can significantly reduce mortality rates. But then, right after that, they say the evidence is weak because of how the studies were done, and we need more research. It's that classic scientific answer, you know? It's promising, but it's not proven. And that leaves us, and more importantly, the doctors on the front lines, with this incredibly difficult question. When you are face to face with an infection that can kill a person in a matter of hours, and all you have to go on is a promising hint instead of a rock-solid scientific guarantee, is that hint enough? Is it enough to act on?